In some groundbreaking work, scientists and doctors use viral gene therapy to cure a rare blood disease. Stay tuned to find out how. Hello and welcome everybody to another exciting episode of Sci Talks 2.0. As always, my name is Dr. Jack Seksenyan, and in today's episode, I will be talking about a recent paper that was published just yesterday in which scientists used viral gene therapy to cure a rare blood disease. But before we go on, I just want to quickly remind you, if you've been enjoying these videos and have not subscribed yet, please go ahead and hit that subscribe notification, and don't forget to hit the bell just so that you are reminded of all the new and exciting videos that are uploaded. I want to thank you in advance for your continuous support. In order to understand the importance of this research, let's first take a look at the disease that the scientists were trying to cure. The name of the disease is called X-linked chronic granulomatous disease, or what I will be referring to from here on out, XCGD. What is XCGD? Well, in order for us to understand this disease, let's take a look at an important immune cell in the body called a neutrophil. Neutrophils are a type of immune cells in the body whose main job is to go around looking for infectious agents such as a bacteria, and by engulfing these bacteria, destroy them and prevent them from causing harm. And as we could see here in this time-lapse photography, the neutrophil engulfs the bacteria and begins to chew it up. One of the chemicals that the neutrophil uses to destroy the bacteria is called reactive oxygen species. Reactive oxygen species are harmful for the bacteria, and it is used by the neutrophil to kill the bacteria. Here in this time-lapse photography, we could see the neutrophil producing these reactive oxygen species as highlighted in that green fluorescent light. That reactive oxygen species is used by the neutrophil to kill and destroy the bacteria. In patients who have XCGD, their neutrophils are not able to produce these reactive oxygen species because these patients have a mutation in an enzyme that is required in generating these reactive oxygen species. Consequently, what ends up happening is that their neutrophils are not able to kill the bacteria. And as a result, these patients end up having continuous bouts of infection, which affects their quality of life and their overall life expectancy. As a result, these patients end up dying at a very young age due to infectious causes. So in this research paper, the scientists tried to correct this gene mutation using a viral gene therapy approach. So in order to fix the mutation in these patients, the first thing that the scientists had to do was isolate what are called hematopoietic stem cells. Hematopoietic stem cells are a specific type of stem cells that have the ability to regenerate the whole immune system. They are very rare in the bloodstream. So in order to get them to increase in the bloodstream, the scientists first gave these patients a specific type of drug which pushed these hematopoietic stem cells from the bone marrow, which is where they're normally found, into the bloodstream. As a result, the bloodstream contained a lot more hematopoietic stem cells and allowed for the scientists to have the ability to isolate these at a much easier way. After isolating these hematopoietic stem cells, the scientists used a virus which is very much similar to the HIV virus. Now, I have to be very specific here. This virus is not the HIV virus, but is in the family of these HIV viruses and is also altered significantly so that it does not have the ability to replicate or cause any kind of harm to the patients. So using this virus, what they did was they took a copy of the normal gene that is needed for these neutrophils to produce these reactive oxygen species and put that gene into the virus. Then, by using the virus, they deliver this gene into the hematopoietic stem cells that they had isolated. So, really quickly, once again, by using this virus, which contained the normal copy of the gene, the scientists infected these hematopoietic stem cells with the virus and allowed the virus to deliver this new and normal copy of the gene into these hematopoietic stem cells. As a next step, what the scientists then did was allow for these hematopoietic stem cells to incorporate this gene within their own genome, and then they took these hematopoietic stem cells and injected back into the patient. Now remember, these hematopoietic stem cells have the ability to regenerate the whole immune system, including neutrophils, which are a type of immune system. So the overall goal of this long experiment was to put a new healthy copy of this gene into these hematopoietic stem cells and allow these hematopoietic stem cells to regenerate the whole immune system with a normal copy of the gene that is required to generate these reactive oxygen species. Now, the overall result of all of this is that the patient's immune system becomes reconstituted with neutrophils that have normal copy of the enzyme that is required to make these reactive oxygen species, and therefore these neutrophils are able to produce the reactive oxygen species and kill the bacteria and fight off infections. Now, using this approach, two centers, one in the United Kingdom and one in the United States, were able to try this procedure on 9 patients. Unfortunately, out of the 9 patients, 2 of them succumbed to death, not related to the treatment, but related to the fact that while the patient was getting treated, they developed very severe infections as a result of their underlying disease and unfortunately succumbed to these infections. Now, the rest of the 7 patients who received this therapy, up to 30 months or in some cases up to 3 years follow-up, most of these patients were doing great. The engraftment of the new immune cells that were transplanted in or injected into these patients were perfectly fine, and the patients continued to live without any bouts of infections and are so far living a normal, healthy life. Now, this is an extraordinary piece of research work that opens up hope and treatment options for many patients. Now, just a quick summary of some of the nitty-gritty details of this clinical trial. This clinical trial, like I said, was a multi-institutional trial between the United Kingdom and the United States, with the United States center being UCLA, and the head researcher at UCLA, Dr. Khan, is known for doing these kinds of therapies in other kinds of immune related deficiencies. In fact, using a very similar approach, he was able to cure 50 babies who have what's called the bubble boy disease, in which these patients lack an immune system altogether and therefore need to be kept inside literally like a bubble in order to prevent them from having any kinds of infections. So using this approach, he was able to treat and cure 50 patients who had this bubble boy syndrome. Now, therefore, he has very strong expertise and background in using this technology to treat many of the similar diseases of the immune system. And as far as adverse effects, these patients who received the therapy had no adverse effects to the therapy, had no issues in the engraftment, and like I mentioned, continued to live a very healthy and successful lives. Clinical trials are still ongoing, and since the publication of this paper, more patients have been treated, and hopefully these patients will do as well as the first 7 that have already been reported. Additionally, this research paper also opens up the doors for more clinical trials and gene therapy approaches for other types of diseases. Now, the history of gene therapy is a bit too long to go into detail in this presentation, but suffice it to say that it has had a few setbacks during the mid 90s, early 2000s, and as a result of these setbacks, it set the field back for a long period of time. But with these exciting results and clinical trials, hopefully it will once again reopen the doors to be able to use gene therapy against other kinds of diseases. So in summary, if we look at the big picture, what these researchers are able to do is using a virus, they're able to deliver a human gene, right? And the normal human gene, they use the virus to help it carry this gene into these hematopoietic stem cells, deliver it into the stem cells, and allow the stem cells to repopulate the immune system. Now, this is an incredible technique, and I find it to be very fascinating and exciting, mostly because we're using a virus which we generally think of as being something bad and something that kills us. And in this case, we're using this virus to actually deliver a gene into the cells, which will then help cure a disease. So it's one way of turning something bad into a golden opportunity. So hopefully, like I said, you guys found this to be as exciting and enjoyed this presentation. And once again, I want to thank you all for listening to this presentation, and please don't forget to hit that subscribe button at the end of this presentation. With that, I want to wish you all a wonderful day.